Welcome to Healthy Mind Science, a show dedicated to translating youth and young adult mental health research into the real world. We have conversations with experts in psychology, neuroscience, human development, computer science, education, and more, with a focus on helping parents and educators take research findings into their everyday lives to ultimately better support our young people. Healthy Mind Science is an affiliate of the Center for Healthy Mind and Mood, which is an interdisciplinary research center at University of Colorado Boulder on a mission to promote emotional resilience and healthy mood in every young person. I'm your host, Alicia, and today I have with me Dr. Jason Nagata. And Jason is an affiliate of the Division of Adolescent and Young Adult Medicine and Department of Pediatrics in the School of Medicine and an associate professor at University of California, San Francisco. So thank you so much for joining and welcome to the show.
Thank you so much for having me.
Yeah, I would love for us to first just to get started a little bit more just about who you are and what your research area is. What are your research topics that you really enjoy studying?
Yeah. So as you mentioned, I'm a pediatrician by training. And so I think actually what really inspires my research is getting to work with teenagers and families and parents who, bring real world problems and questions to me and challenges to help try to problem solve them. And I do think that a lot of my research now focuses on trying to provide evidence based guidance for parents and teens on how to sort of navigate the modern digital landscape, whether it's social media or AI or any of these new technologies that are really becoming ubiquitous in teenagers' lives, but we actually have very little, relatively speaking, evidence as to like what are the best practices for how to use them, what are some of the risks, what are some of the benefits, and how do we optimize those benefits while minimizing those risks. And I think that day to day, seeing patients or teenagers and families really grappling with these issues has really inspired me to try to better understand, like from an evidence and research perspective, like what are some of the risks, what are some of the benefits, and how can we advise teenagers. And yeah, my particular area in pediatrics, I should have mentioned, is adolescent health. So it's a specialty. Primarily focused on working with teenagers and young adults. And I just learned so much from them because there's always new technologies. There's always, like, every day there's new apps and things coming out. And so there's always this is a very, I think, new and novel field.
Yeah, there's so much there. And first off, thank you so much for doing that work. And I think, especially bridging that the practice and the research is so critical. I think, and it makes sense as to why you're doing this type of research. And the way that you're writing also is very accessible to folks. So thank you for what you do. One of the things that I wanted to dive into more is just how you got interested in this. Do you have any stories that you would share or experiences, even just at a high level of like, what did you start to notice or see that you're like, I want to dive into this a little bit more on the research side?
Yeah. Um, that's a great question. And definitely the focus onto research on social media actually was directly derived, I think, from patient care, particularly for teenagers with eating disorders. Actually, one of my clinical specialties is caring for teenagers, unfortunately, who develop eating disorders and then can develop like medical complications and certainly mental health complications related to that. And I just remember during the pandemic, obviously there were lots of we were sort of amidst the youth mental health crisis and just broader issues. And so we at our hospital saw like a tripling of cases of eating disorders, referrals, hospitalizations. And I think that youth were really struggling. And I just remember one day during the pandemic working in the hospital among teenagers who, unfortunately, if an eating disorder becomes so severe, they have to be hospitalized for kind of medical stabilization. And I remember taking care of numerous teenagers who, despite the fact that they were very sick and had significant complications, were basically glued to their phones and social media in the hospital and actually were posting content and consuming content that was really detrimental to their sort of eating disorder treatment and recovery. And I remember thinking, uh, like, this is a real problem, especially, obviously, I think one of the nuances that we'll get into is that some of these effects like do matter, based on like a range of factors, and including like whether people like have underlying mental health condition or not. But I was definitely seeing that among people with eating disorders, there were definitely ways that social media was sort of exacerbating those symptoms, or in some ways like um, serving as a barrier to like their treatment and management because while we were advising some stuff related to nutrition, they were getting a ton of other content that perhaps had misinformation or sort of pro eating disorder, pro anorexia nervosa content that I thought was very troubling. And so I did get into the field, I think, more from a concern out of caring for people with eating disorders, and particularly some of the body image and eating disorder content. So a lot of my early studies actually were focused on links with social media and eating disorder risk, and then subsequently have broadened out to broader mental health and physical health as well, because obviously there's many potential areas of risk and benefit.
Yeah, thank you so much for sharing that, and I think what I love about it is that you kind of witnessed it, but then we're trying to understand, like, is this happening on a broader scale? Because right, like, is this just happening with, like, certain types of groups of people, right? Is it certain content? There's so many questions in there that wanna explore, but I know it's really complicated, so I'm excited to dive into this more. But thank you so much for sharing that and again, for diving into this. So we can transition into the topics that we were going to talk about today. And so we're going to talk about two papers, and one is a study. I'm really excited using an ABCD study data set, which is the largest data set on adolescent brain development in the United States. I'm really excited. I don't know if that's actually Globe too, but you can correct me if you want to add more context to that later. But I think that's really important. And then the other one is going to be a review that's talking about some health benefits of social media use with young people. And so I'm really excited to dive into both of these pieces because this is a really complex topic. And I know you've also done so much other research in other areas. So these are just two of many, many studies that you've done. And so folks can definitely reach out and learn more about your research. But we can start with the social media use and depressive symptoms during early adolescent study. And so I'm just going to quickly shout out your co-authors' last names. So including you, it's Otmar, Shim, Balasubramaniam, Chang, Ali, Al Shabai, Shao, Gonson, Testa, Kiss, He, and Baker. So shout out to those co-authors for engaging in this study. And I'd love for you to just give maybe a little bit of context to the study, what was happening, kind of as you were developing these hypotheses and data set.
Yeah, thank you so much for highlighting this study. And I will say that the sort of question or premise for this study is that, if for people who have entered the sort of social media and mental health discussion or debate, I think there actually has been quite a bit of ongoing debate about whether social media contributes to depression or simply reflects underlying depressive symptoms. So, like, what's the directionality? Like, does social media cause depression, or are people who are just already depressed going to use social media more? And so, I think a lot of studies up until this point have just been studied at one time point. So it's hard to tell what's cause, what's effect, what's the chicken, what's the egg. And as you mentioned, the adolescent brain cognitive development study, also known as the ABCD study, is just a really rich source of evidence because it's one of the largest national studies on adolescent brain development. It's followed 12,000 9-year olds every single year, and it's still ongoing. And the plan is to follow them like through all of their adolescent and teenage years, and even into young adulthood. And so we have sort of repeated measures every single year, like age 9, 10, 11, 12, and onward, in a way that we don't typically have for other studies. So there's just a lot of data, and there's data on the same individuals over time. And so that does allow us to do more complex analyses that allow us to get a little bit more at like time ordering of cause, effect, risk, um, sort of outcome. And so in this study, we followed social media use over the first 3 years of the study, as well as depressive symptoms during the same time period. And we did find that in the first 3 years of the study, so in general, like when kids were starting at age 9 up through age 13, that actually daily social media use on average rose over tenfold. At the beginning of the study, it was about 7 minutes a day, and then it was over 70 minutes a day 3 years later. I think one important thing to know is technically most of the study that we analyzed was actually like would technically be considered underage social media use because the minimum age requirement is supposed to be 13 years old. So these are all people who, it's easy to get around that. You just put in a fake date of birth. But it's all this use is technically like underage use. And then in the same time period, we did also see that depressive symptoms increased by about 35% overall. But we were able to do sort of ordered analyses where we looked at like whether social media or like changes in social media predicted subsequent depression, or if changes in depression predicted later social media use. And we did actually find that higher social media use predicted later depressive symptoms. So the evidence for like social media leading to depression, but we didn't find evidence for depression leading to social media use. So we sort of tested both directions, and we're able to find a little bit of evidence that like social media may contribute to changes in depression. So I do think that it still is a what we call an observational study. So we didn't do any interventions, and we just kind of followed people over time. And there are obviously many other factors, um, that can contribute to depression. The pandemic also happened during this time point, and there are certainly genetic and biological and other factors. But I do think that social media is still an important factor to look at because it is potentially modifiable, and there are sort of actions that teens and parents could take to change some of these patterns of use.
Yeah, and even though it's been around for so long, we just really don't understand quite yet of like how the effects are actually happening, who it may be happening for. So what I loved about this as well, and we've started dabbling into kind of the social media research, and I was really surprised at yeah, some of the lack of really like longitudinal studies. I think for sure. But then also looking at that bi-directional relationship. So social media use impact on depression, but depression impact on social media use. Because again, like you said, it's really hard to sort of disentangle those if you don't have that like a strong data set like the ABCD study data set. So that's really exciting. And I think too, the other thing that like I really liked about the study is that you looked at within person differences as well as between person differences. I wonder just if at a high level, can you talk a little bit about like what that means and why it's important to study it? Because I think that some folks aren't necessarily studying it in this way, and why that's helpful kind of to better understand this.
Yes. So kind of at a high level, between person differences is like between different individuals. So I guess, for example, between Alicia and myself, like Alicia has certain social media patterns, and that's, linked to mental health, compared to my social media patterns, which may be different. You are comparing like different individuals against each other. But then for a within person analysis, we're looking at like sort of an individual's own data over time. So, like, if I was a participant in the study, it would be like, when I was 9 years old, what were my social media and depression or mental health symptoms? And then the next year, what were they the next year? So it follows like my own patterns. Like, it could track, for instance, if by the time I was age 13, like I had a big spike in social media use just for myself that was higher than my normal baseline, but then the next year I decreased. How did that affect, the next year's mental health symptoms? And so it's tracking the same person over time and how changes in your behaviors may predict, mental health outcomes.
Yeah, and I think that that's going to come into play when we talk about the review as well. So I just wanted to like point that out of how that kind of nuanced kind of understanding is, but that within person of increases in social media use were associated with higher levels of depression. Yeah, I think that that's really interesting. Anything else from the study that folks should like take away from that?
Yeah. I do think that it was good study because it did look at these effects over time in the same individuals. And I should just clarify that the main effect that we did find was like the within person effect. So like if I had an increase in social media use, then I subsequently was more likely to have depression the following year. So we did find these in like within person or same person effects, which I think were also important. Um, but I will say that our measure of social media in this study was time. It was like self reported time. So, how much time they were spending on social media. And I do think that time is important in that, we have limited time during the day. And so, I think just regardless of the content or the quality of stuff that we're doing, like, time spent on social media in general might replace or displace like physical activity or face-to-face interactions or sleep, which can all be important for mental health. Um, but I do think that um, certainly the content and quality of what you're doing in the context really matters as well. And so I think other studies going forward, looking at specific content aspects like cyberbullying or like there's or like doom scrolling or certain types of things that may be particularly the sort of key players in the drive for depression.
Right, right. Yeah. And I think that there are some folks who are in the early phases of doing that, right? And so it's like, how do we integrate that in also a longitudinal study that's also looking at how things change over time? Yeah. So we'll get there.
Yes.
um, uh, so maybe let's go into the review, and I'm sure we'll also kind of hop back and forth after after we talk about the review. So the review, the title of the review is "Health Benefits of Social Media Use in Adolescents and Young Adults," and authors were Nagata, Huang, Her, Lee, Helmer, Weinstein, and Moreno. And so I'd love for you to share a little bit more about kind of the purpose of that review. What is a review, as well as kind of what you found.
Yeah, thank you so much for highlighting this as well. I think first I'll start with the sort of purpose of this study, and that I think is that in general, social media I think gets a bad rap, like in the media and with parents, and I think there are potentially harms like depression or displacement of sleep that are real and should be investigated. But I do think that social media isn't inherently bad or good. I do think that there are some potential positive aspects. And so I do think that in this study, we were trying to understand like what are potential benefits of social media use, particularly from like the teens perspective. Like, as I mentioned, like I work with a lot of teenagers and I think there are some teenagers who acknowledge that they would like to decrease their social media use and they are sort of acknowledging some of the potential harms. But I do think there are a lot of teenagers that do get benefits. And part of the reason why it's so ubiquitous and it's used so frequently is that there are potentially benefits. Like maybe they're not like health outcomes, but they could be for like socialization or or education or learning. And so I think we wanted to just really understand from particularly from a teen's perspective, like what are the benefits of social media use to also just better understand like why social media is so used, especially as like a doctor. I think one like parallel that we've learned like from practicing medicine, especially with teenagers, is if you sort of enter a conversation with like a very negative valence, like teenagers are not likely to open up to you about like what they're actually doing. So if like I think we've learned this with say like substance use or sexual and reproductive health. Like if you go into like as a pediatrician, if you say like smoking is bad, like no sex, like they're not going to tell you like what they're actually doing. So I
Right.
think like what in general, what like physicians are trained is to sort of have more of an open stance, at least when you're like initially assessing, just so that you get the information that you need about use, and then you can provide anticipatory guidance or counseling as needed. And so I was sort of thinking that we could have a similar lens with this. I think if you go in with the sort of the opinion that like social media is bad, you need to stop screen time. That kind of shuts a lot that teens might have. I mean, and I think this also applies to parents too. And so I think part of this review was to try to understand, like from a teen's perspective, what are the benefits, and trying to understand the benefits. I think can help us also like guide our teenagers to sort of balance the risks and the benefits. Um, so to your second question about what is the review, um, so the first study that we mentioned is like I guess a primary research study where we had where the ABCD study has like followed like recruited patients, gathered data for them, and followed them over time, and then we did like an analysis of these 12,000 individuals. Um, a review article is sort of like a summary of all that. So the things that a review article study is not actually individual patients or individual like participants. It's actually taking data from other published studies and then trying to synthesize the evidence across all these published studies. So a review is really trying to like summarize what have all these studies so far on this topic found. So this review was trying to search all the literature that has been published on like what are potential benefits of social media in teenagers specifically. And so some of the areas that we found were, I think, first, as I mentioned, like social connection. I mean, social media in its name is social. Like, I think the initial goal of the development of social media was to try to promote connection um, uh, and I do think that, to some extent, there are connections online um, that are made possible that just are not possible face to face. I mean, one example is if you have friends or uh, uh, family like across the country or across the world, like it does allow you to connect with them, like when person to person contact is not like as frequently possible. So I do think that that's one big benefit. Obviously, a lot of people are still on social media with people who actually live in their neighborhood or go to their schools, and then that's also another, sort of supplement to in-person socialization. But I do think that um, social connection is is important, and I think because social media is so ubiquitous now, to some extent, I think teenagers do feel a little bit of fear of missing out if they're not on social media. So even some teenagers who don't themselves particularly care to be on social media, like we heard, um, will be like, well, if everyone else, like actually, like one example, I would say one of my patients was that she actually didn't want to have a social media account, but her soccer team, because everybody was on social media, like posted their practice and game schedule on Instagram. So she like had to get an Instagram account to see like when her practice schedule was. But it's just an example if everybody else is on it and that's like the way that many people are communicating to some extent, like even for like core functions, you have to like be on it.
I had a similar story come up recently about this, and I was like, "Wait, what?" But that's yeah, it makes sense in a lot of contexts, but yeah.
Um, and then I will say that another sort of area that we looked at was identity formation, support, and acceptance. So I do think that particularly for like perhaps marginalized youth, like LGBT youth or racial and ethnic minorities, you could imagine that like perhaps freshmen in high school who may be like grappling with coming out as like transgender or something, maybe the only, or like maybe there's no one in their school who's out, or that, in their physical school, in their physical neighborhood, physical community, perhaps they don't know of anyone. It's hard for them to find other peers. But when you have access to like the global community, whether it's like the rest of the country or the world of, you all of a sudden have access to like all these other individuals who maybe are the only kid in their community with a specific grappling with a specific, whatever it is, like whether it's sexuality or gender identity, or even to some extent, chronic diseases. I think one of the other kind of understudied areas is, when we care for like individuals with rare diseases, like again, they might be the only kid in their town that has experienced this. Like, I mean, for instance, I know there's a strong like cystic fibrosis community online where teens connect with others who have that shared experience all over the country, all over the world. And I do think that that helps with support and acceptance. And then in the case of like sexuality and gender, like even identity formation, the teenage years are times when you're discovering a lot of these things. And so there is a lot of support and acceptance that can come, particularly for, minority or marginalized adolescents.
Yeah, I really, I'm glad that you highlighted this because that's something that I've kind of seen as well when I was diving into this research of how, for some groups, it can be really helpful, especially whenever it comes to, yeah, like feeling a sense of belonging, right? Like you may not feel that in your physical community, or you don't feel like you can be your authentic self, but perhaps like you're seeing others online who either are their authentic self or portraying an authentic self. But it feels like, okay, well, maybe I can be myself at least in this space. And so, like, that's really powerful for a young person to feel that, even if it's not in the physical world, maybe yet. And hopefully that would translate eventually to the physical world. But we know that there's so many factors in that. So, yeah, thanks for highlighting that. You also talked about a couple others that I'd love to dive into around the positive pieces. Yeah, if you want
Yeah.
to dive into those.
Yeah, and then I think in terms of mental health specifically, while we have done some studies that have links with depression or other kind of or eating disorders or other mental health conditions, I think one interesting phenomenon that has happened on social media is almost actually the destigmatization of mental health. So I do actually think that there are also some like high profile influencers who actually open up about their own mental health struggles, and in some ways having like prominent person or an influencer like talk openly about some of these issues that they're doing does to some extent normalize some of these struggles. I mean, we know that a large proportion of teenagers do experience symptoms of depression or anxiety or loneliness, and having other people open up about them does make perhaps people feel less alone, or just normalize some of these conditions more. And I know, like, particularly in the eating disorder field, sometimes there are people who open up about that, even celebrities and stuff like that. And I do think that I've seen that that has been helpful for some of our teens who are, grappling with that and themselves, to address stigma and also kind of not feeling so isolated.
Yeah, I can remember, like, whenever I had this internal experience that I just thought it was me, and then I remember hearing a colleague, this was, like, an experience that was really, happening in my, like, early adolescent, young adult life of, um and, this person shared their experience around social anxiety, and I was like, "Oh my gosh, like, you experienced that too?" Like, I had no clue how common that was, and also, just that she was able to, like, explain it in a way that I exactly felt. It felt so, like, this connection piece, it made me understand myself better. It just helped so much, and, like, I just think that that can be so powerful, especially for a young person who's grappling with it or trying to figure out, like, is this a normal like, feeling or emotion, or is this something that maybe I need more support for? I'm not sure, and I think it can be really, yeah, helpful to kind of hear somebody else's, experience and story, to make it real for you and make you feel, less alone. Yeah, it's so powerful. And then you talked about health education benefits as well, and I know that's also nuanced, and you did represent that in the study, or in the review, so I really appreciate that. But yeah, do you want to talk a little bit about the health education benefits as well?
Yes. I mean, I do think that there is lots of information on social media, and I think we have to be careful about misinformation, because there is quite a bit of misinformation, particularly on health issues, like you know for, for instance, disordered eating. But that being said, there is also like um relevant and like uh, true information on social media. And so I do think that it is an opportunity to provide education and for like young people to learn. I do think that in general we do advise teens and parents to um, just with some sort of digital literacy tools to try to understand like what is, or to have like a little bit of some practices to sort of verify information, whether it's like, checking who's the poster, and like what are their potential intentions or conflicts of interest, like if it's in paid advertisements, and also like what are their credentials if they're providing health information, like what are their credentials, like are they a licensed provider, or are they just like a teenager saying what they think. And then also, if something doesn't quite seem right, trying to verify like with another source, like whether like outside of social media, like trying to look up yourself, like, does this seem right or not, just to get, you know, verification. But it's just to say that there is accurate information out there, and it is an opportunity to provide, um, health education among a range of topics. And so I think there is a lot of good information out there. It's just important that people kind of vet what is true or not. And I think we were talking about this earlier, but for all the research that we do. I mean, I personally think that because so many teens are on social media, this is like the way to reach them. And so we do like all the studies that we've published, like this health benefits review and the social media and depression review. We do try to post infographics and content that's accessible to teens and their parents. And I mean, our lab does have a social media account, and we do post it. So I guess that's an example of where we're trying to promote health information about these studies or topics or tips for teens and parents. And I do think that there's a lot of institutions and health, like in health care, either practitioners or hospitals that do provide information on social media.
Yeah, and I really appreciate that, and I definitely wanna have all of those accounts so I can make sure to share those with folks as well. But I think it's so important because, yeah, if I think, oftentimes if you are an adult that is sort of separate from that social media world, especially with young people, you can feel like, well, they're listening to all this, bad stuff, but also it's, like, part of our responsibility that if they are all there, like how can we contribute positively to that experience potentially? Um, and I think too, like how like I think that some of us kind of in older generations are like assuming that young people should just know how to differentiate between what is a good recommendation versus what is maybe something that isn't, and how do we have those conversations with young people so that they can feel a little bit more confident in being able to differentiate and understand that not everything that see, even if it, you know, is something that you wish was true isn't necessarily true, right? So I think like how do we teach young people the skill set to navigate those pieces, especially when it comes to health education, because it is really important for them to learn and also to be able to distinguish what's yeah what's real. So yeah, really really important stuff. So when you take both of these together, obviously we see kind of in one study that in early adolescence. Um, there can be some evidence to suggest that social media use can, uh, relate to depression symptoms, right, later on. And also, we're seeing some health benefits in some aspects. What is your like? How do you make sense of that as both a pediatrician and a researcher?
Yeah. Um, Thanks for that. And I do think that, it is a very complex digital world that we live in. And I think that understanding some of that or acknowledging some of that complexity. So I think my general framework is that, social media and screens are not inherently good or bad, but there are, some potential risks. And I think as teens and parents, we just want to do our best to try to mitigate those harms or potential risks. But if there are benefits to, optimize on those benefits. And so you're reaping the rewards while trying to minimize the harms. And one potential way of doing this is the American Academy of Pediatrics has a family media plan, which is sort of acknowledging that there's not a one size fits all solution for all teens and all families, but just to sort of start with an open ended conversation with your household, considering like what are the ages of your kids, what devices are available at home, and then also just practical considerations like maybe it's not feasible to ban phones if you need to call your kid for pickup, like if there's logistical things as well. So it's not like a one size fits all, but understanding like what works best for your household, again optimizing the benefits and the use cases for technology while trying to minimize opportunities for harm or risk. And actually the ABCD study does ask the parents of these teenagers like what are some of your um, parent practices related to screens and media use, whether it's like monitoring or rules in the household. So we were actually also able to study this empirically, like what are some of the practices that were associated with like lower social media use or lower problematic social media use, like aspects of social media use that could lead to problems or addictive symptoms. And we actually found that sort of three takeaway points. One was that one of the biggest predictors of teen screen and social media use is actually their parents' screen and social media use. So it's really important to practice what you preach. And if you're going to make a family media plan that's sort of a set of rules for your household to follow, it's actually important that you follow those rules too. It's not just your kids have to follow those rules, but you have to be a good role model and say like if you say no texting at dinner table, then you shouldn't text at the dinner table either. Otherwise, nobody's going to follow the rules. And then uh, if it's not possible to have like total screen limits, two potential times to that are kind of high yield to limit are like at bedtime or right around bedtime, just because we know most teenagers don't get enough sleep, and sleep is so important for your mental health and brain development. And I do think that one of the ways that social media could impact mental health is through displacement of sleep. If kids are like staying up later and getting woken up by notifications, that can really be disruptive then for the next day, and their overall rest. So actually in the ABCD study, we found that the best thing to do is to, have if you have a phone or a device, to actually leave it outside of the room entirely and turn it off. We found that actually like actually 2/3 of teens have a phone or a device in their bedroom when they go to bed. And that was disruptive of sleep. And if it is going to be in your room, to turn it completely off. And that's even better than leaving it on silent or vibrate. We actually found that kids who had it on silent or vibrate still had worse sleep than those who turned it off. Just because I think if you happen to like get up at night to go to the bathroom or whatever, and then you just check your phone and it's already on, then I think if you get the notifications or the messages, that all of a sudden your brain is activated and it's harder to fall back asleep. Um, so those are some like sleep related tips. And then the other kind of time to consider limiting screen use is around mealtime. Actually, in the ABCD study, we also found that parents who allowed screen use or social media use during meal times, um, well, their kids overall were more likely to have more like problematic use of media, but actually eating during meals also is kind of distracting you from eating. And so kids actually overall tended to overeat and gain more weight and even um, like eat in the absence of hunger. So like if you're kind of if you're binge watching Netflix and you're not really paying attention to what you're eating, you're actually more likely to while you're binge watching, you're more likely to binge eat. And so you're kind of like not paying attention to your hunger cues. And also, I think that, meal times are also just an important time to connect with your family. And if you can use that time to check in or have a conversation, but with how your kid's day is going, that also makes it more likely that you're able to, you know, be aware of some of these potential risks or things that are going on. So it's just a good opportunity to have a face-to-face conversation or connection if possible.
So good. So, so good. And I'm really glad that you brought up sort of, it like, I think the other thing we're trying to uncover kind of in the research is it the time spent on social media and the actual that is the impact, or is it what you're taking away from? So because you're on your phone, you're not engaging socially with other folks. You're not necessarily getting the best sleep potentially. And those are two really big protective factors for any kind of mental health, right? Challenges. And so those help us navigate mental health. They also help us, again, protect from having severe symptoms with those. And so I think, thank you for sharing that nuance because I think it's an important one too that we're also all trying to understand from the research side of things. So super helpful. Anything else that parents or educators should like take away or you want to highlight from our conversation today?
Um, no, I just think that uh, to summarize, like I do think that there are some benefits, there are some risks of social media, and so I do think that depending on like, your individual teen, you may have a better chance of like meeting them where they are by acknowledging some of the benefits rather than just having a unilateral like ban. This is bad conversation. I mean, again, it depends on the your individual teenager, but I do feel like many teenagers have some motivations for using social media, and I do think that sometimes the rules that we have may not be effective unless they understand or like unless we understand the full context and then the teen is also able to buy in to some of the and understand some of the rationale for why we might have some rules or why we might have some recommendations. And I do think that from a developmental perspective, eventually these are our teenagers are going to be adults and they're going to be making these decisions for themselves. So I think part of the goal is also to teach them some of these digital literacy and management skills so that when they're off, when they're young adults and adults, they can have the tools to make these decisions for themselves. Um, which I think, I do think that uh, developmentally, like it's appropriate to have stronger and stricter rules for like younger kids and younger teens, but potentially as teenagers get older and they're getting closer to being able to make some of the decisions for themselves, you might allow more autonomy if it makes sense. So I do think that that's just another aspect to consider when you're thinking about household rules.
Yeah, yeah, definitely incorporating that scaffolding of of like let's be like strict and protect and then also like educate like as they grow and learn as well.
Yeah.
Yeah.
And I do think that the teen has to have like having conversations about why is also important because teenagers are typically more tech savvy than parents. So if they don't agree with the rule, usually they're going to find a way to get around it. Like even if you think that you've been like, uh, so they have to have, I think, some sort of um, understanding of why.
Yeah, and you're like, I think that like engaging in conversation with young people is so important. And oftentimes we as a society are just like bombarding them about what to do, what to feel, how to do it. right? We're just like kind of this like top down approach. And to some extent, that is potentially like good, right? To help them kind of develop direction. And then oftentimes they don't get listened to, right? As a result. And what I love is that you're really trying to incorporate youth voice both in your research, but then also in your practice to like, how do we engage young people to like talk about this more, to reflect, right? To build that self-awareness and then the skill set to understand how to navigate these tools and technologies. So, so good. Well, thank you so much for being on the show. I really appreciated it, and you and the work that you do, and this conversation. I just think it was so powerful, and I think a lot of people are going to get benefit from it. Um, I will make sure that folks can connect with you, and so everything will be linked in the show notes. But yeah, thank you so much for joining the show. Really appreciated it.
Thanks so much for having me. It was a great conversation.